They travel here to enjoy the peace and tranquility of Mother Nature. Some visit to remember loved ones lost to a terrible disease. Others come to try to forget. Retired nurse Kate Ratliff came to the AIDS Memorial Grove in San Francisco with her wife. She witnessed the first cases of AIDS 30 years ago, before the disease even had a name.
It was frightening and upsetting and terribly, terribly sad, and happened very quickly. From diagnosis or from the obvious illness to death was so rapid.
Some of the first AIDS patients came here to San Francisco General Hospital.
I distinctly remember all sorts of planning we would do with our patients. This is going to be the last holiday. Do you want to go travel to see your family? It was planning for those kinds of events.
The city's largest AIDS agency began 29 years ago.
In those early days, it was very much crisis intervention. It was protesting. It was trying to get the attention of government leaders, mostly at the national level, because here in San Francisco they were very responsive from the very beginning. There was a time when the San Francisco budget to deal with HIV and AIDS was larger than the federal government's.
The stigma of AIDS has also changed. There was a time when the public did not understand how you contract HIV and AIDS, and patients, even children, were outcasts.
I was told of a situation in Florida where 3 young brothers, ages 10, 9, and 7, were all hemophiliacs carrying the AIDS virus. The pastor asked the entire family not to come back to their church. Ladies and gentlemen, this is old-fashioned fear, and it has no place in the home of the brave.
30 years later, AIDS is no longer a death sentence, and a cure may be in sight thanks in part to this man. Timothy Brown received a blood stem cell transplant to treat leukemia. It not only cured his leukemia, it also got rid of his HIV.
It made me feel great. I kind of think it is a miracle, and it actually has changed my whole perspective.
More research needs to be done to see if Brown's treatment would work for other patients. With all the medical advances and changing attitudes towards AIDS, it's become a struggle to keep focus and funding.
One of the greatest challenges we have in HIV right now, we feel, is complacency. And we feel that HIV has fallen off the radar screen of the public consciousness.
The medications have been good, and so people now lead full, productive lives on medications, dealing with their HIV status, and that's very, very positive. But yet, still in San Francisco, 2 new infections a day. So we still have our work cut out for us.
More than 30 million people worldwide are currently living with HIV and AIDS. Almost 30 million have already died from the disease. Haven Daily, The Associated Press, San Francisco.